Dr. Mark Wisniewski, known as Dr. Mark. I've been practicing dentistry for 27 years. A patient came to me with, she had multiple sclerosis, and she asked me if I could remove her mercury fillings. Of course, you know, being a conventional dentist, I said nothing was wrong with it, you know, wasn't causing the disease, and you know, she wanted to know if I could do it safely. Well, in my area, I am the only person that uses a rubber dam, or at the time, you know, and I thought, well, I'm the safest person there is, you know, so I told her sure, and I met with her several times and removed her fillings a little bit at a time, and for some, you know, it triggered this thinking in me after these multiple conversations I had that maybe there might be something to it. So on that weekend, I remember I went home on the weekend and I started researching toxicity of mercury and mercury amalgams, and it was quite surprising to me about the studies that I was seeing on PubMed and different. I just started downloading studies. I became this kind of fanatic about reading more and more about mercury and mercury toxicity. I started ordering all of these studies. I was stunned because I found out that I was toxic, that the tremor that I had at the time, I thought, well, you know, Mark, you're turning 50, you know, you must be, you're getting old. And my memory was so bad that my assistant of 10 years, I had to stop and think what her name was at times. And I just thought I was getting old. I said, well, this is maybe what it's about. And so then the more studies I read, the more I started to realize I was toxic. You know, I had eczema. I've had eczema since I was in dental school. I didn't know that this was, you know, a symptom. So it was all of these things, and anger issues, just really tough. I was having a tough time with life, and I didn't know it. I thought you know, like all people who are toxic, I don't think they realize at first what's going on. I was very excited to find that IAOMT, and at that time when I joined up, after the first meeting, I learned how maybe I could start to unwind this mercury toxicity problem. And I slowly started doing some detoxification procedures, and lo and behold, everything got better. I became like 20 years younger. It was unbelievable. When I work with patients, we're biologic dentistry. We're trying to practice biologic dentistry, so we're trying to get them to do a lot of things, and helping their diet, getting them to do things. I reflect to them maybe what I did to detoxify, so we get them doing these things while we're removing their mercury. And similar stories to mine: memory, sleeplessness, anger problems. I mean, you see personality changes. It's in some people. Some people, not so much. You don't see this outward, at least not, they don't recognize. But I will say that as with my patients, you can tell when you see this person, they look more healthy. The tissue changes. There's something about it that you know when you see this person that something has changed. Something has flipped in their body after the mercury removal. There are many. Every person's story is different, and every person's symptoms are different, and it can be anything from a disease that by removing this burden, this toxic burden, perhaps that allows their body now to become strong enough to kick the disease. To simple symptoms like eczema patches. I have a patient who had been for 3 years to a doctor, horrible, basically the entire chest eczema. And we took it, and he had a mouthful of mercury. And we took his mercury out, and it is totally gone. This is definitely a burden on many people's health. And it's toxic to everyone. Some people show, you could have 1 filling and be sick. And some people can have 20 fillings and live with it for 30 years. But that's the problem. Mercury coming out 24 hours a day for 30 years. And then all of a sudden, they start to break down. Blood pressure, cholesterol, nervousness, all kinds of issues that are very difficult to believe and impossible, more or less, for us to prove because of the slow-acting type of poisoning that you get from the mercury. And very excited about spreading the word and helping people. The mission of the mission statement of the Academy is to better the public at large health, which really I finally understood was what my mission in life was.